Hi, my name is Greg McKettrick. I'm a pharmacist with Stanley Specialty Pharmacy. At Stanley, we treat a wide variety of patients, but a large part of our patient population are men with sexual dysfunction and erectile dysfunction. We treat a great population of patients who either have or are about to undergo treatment for prostate cancer. Over the course of years counseling these patients, we really identified some very similar stories, issues that patients continually relayed to us. These involved lack of understanding of what the side effects were going to be from their surgeries, and then really lack of support to address the side effects over the long term in their recovery. These patients would come in sometimes months after surgery, sometimes years, sometimes a decade after surgery. All this time dealing with erectile dysfunction and urinary incontinence, and really not thinking there was anyone that could actually help them with their issues. So at this time, we developed a treatment protocol, the Stanley Penile Rehabilitation Protocol, to address these patients. The protocol itself follows the patient from a period prior to surgery, after their surgery, and through the years of recovery.
It's been a very unique journey for me. My wife had died, I had a girlfriend, and I was having some erectile dysfunction, and I couldn't figure it out alone. I was trying Cialis and Viagra and so forth, and I wasn't getting anywhere. I then investigated a little more, talked to the pharmacist here at Stanley. With their help, I felt compelled to go ahead with the prostaglandin injection, and that really worked well for me. The pharmacists here at Stanley, I think, are extremely well informed, and I found that if I wanted detailed information, that's where I came. All of this has had a profound influence on my life. The use of these pharmacologic agents has enabled me to carry on a romance. That would not have been possible without the consultative information that was provided here. But I would encourage anyone who has the urge to be sexually active as they get older, or even if they're not older and have erectile dysfunction, this will work.
We work very closely with the patient and the referring physician to ensure that the patient's questions are answered, that the physician is continually kept in the loop, and that any changes in therapy or progress notes are reported in a timely manner.
What Stanley offers that's so unique with this protocol is it really does touch on the idea that there's disconnects between patient, physician, pharmacists, and the overall goals of what we're trying to all get done. I think this is a very translatable program to everywhere else in the country because we're all dealing with the same things. And what I've been so grateful for with this partnership is that it's not about me sacrificing my patients up. I'm not giving up my patients to someone else and saying, please take care of them. What I'm doing is saying, please help me take care of my patients. So by having these protocols, by working together, having you at Stanley being able to provide patients more counseling than I can do and getting that touch points with them, it's reducing phone calls. It's actually improving patient adherence. The compliance is improved. The rate of returns of patients are improved. And that's really been a value add for our practice as well.
The protocol starts with the least invasive measures possible. As we progress with the patient in their treatment through courses of physical therapy, exercises, medication therapy, supplemental therapies, we move on to more advanced treatments. We at this time would be supporting the physician's role by answering majority of the questions, handling patient dose changes and submitting for therapeutic changes for physician approval. In some patients, some of these issues we cannot completely address through the protocol. Because of that, we have networks of specialists that we work with, special physical therapists that address urinary incontinence, surgeons who treat urinary incontinence with bladder slings or artificial sphincters, and specialized surgeons, in some cases, who would work with the patient towards implanting a penile implant. All of this is designed to give the patient a very clear, comprehensive path through their recovery. We address each patient personally. We spend a great deal of time working with them and reporting back to their physicians. All of this with the goal of improving patient outcomes and seeing that these patients have a return of quality of life. If you'd like more information on the Stanley Penile Rehabilitation Protocol, please visit our website at stanleyrx.com.